So once you understand these chemicals and how the chemical has to be rebrained and how to segregate these chemicals, you should know what are different types of addictions. This doesn't mean disclaimer, disclaimer. होता है ना कभी भी एडवर्टाइज के नीचे भी होता है डिस्क्लेमर या इंश्योरेंस के नीचे होता है डिस्क्लेमर इसके लिए कि आई एम टीचिंग ऑल दिस ड्रग्स ऑफ एडिक्शंस दैट डजंट मीन आई एम गिविंग नॉलेज हाउ टू टेक दिस ड्रग्स this is for your knowledge so that you can prevent it. This is not for your knowledge that you should start these drugs. I have not tried this. अरे ये सर ने तो ये नया कुछ फंडा बताया है. I should try this. There are so many, but we have highlighted some things which are very common in youngsters and teenagers. See, alcohol, caffeine, nicotine, morphine, cocaine, heroin, marijuana, LSD, ketamine, Valium. So many lists is there. I have just highlighted few. Very common. These are some newer addictions. They have included in psychiatry also. These newer addictions are mobile, sexual addiction, gambling, pornography, shopping, internet, TV, Facebook, chatting, WhatsApp, social media, Instagram. So you are young generation. I was just having a lecture in one college, and there I came to know. I was in a impression that people are using still Facebook, but he said no, trend has changed. We are using Instagram. Very good. Because of that only this addiction centers has started. It doesn't have any role. This list I am talking about. It doesn't have any physical. You don't have to take anything. कुछ मैंने खाया, कुछ पिया, कुछ लिया, कुछ snort किया, smoke किया, nothing. This is just acting on your brain. And still there are addictions. Shopping, Amazon, Flipkart, Instagram का one more I'm saying, Reels. Just I heard one politician, he said in his speech very nicely, the people used to go in this pubs and dance bars and they used to make money and all that, they used to like this. Now people are also fond of the same thing, shorts and reels. I am talking because I am very outdated person. I don't have any social media accounts and I am not using WhatsApp. Also using WhatsApp, but for my purpose only. I am not taking this WhatsApp with me every time. I am still using it. I have social media accounts, but my social media accounts, they are handled by some person, where we talk or we have only programs which are related to awareness, addictions, and all that. I don't do all this hi and hello and where are you and why don't know and why. So I don't have time also for that. We talk something about this because nowadays this is a need of hour. These addictions are very common nowadays. Though you find, अरे सर क्या बोल रहे हैं, अरे ये तो this is part and parcel of my life. Addiction, technology addiction, internet addiction, ये तो इसके बिना तो रह नहीं पाएंगे. I can't live without this. Statistics to open your eyes. These are statistics taken from government sites. India has most internet addicts in the world. Number of subscribers, number of users, number of people using smartphones are also high in India. And because of this, companies who are selling their products with very high data, it's been given free by some company, and after that you have started using that. You don't know when you get trapped in that. I think you are in the 10th standard. That time Corona was there in the, and that time it was a high surge in data packs, and from that you get addicted for that, and you don't know when we get addicted for that. India tops the world's number of selfie deaths. क्यों selfie death ज़्यादा होती है? यू वांट टू ट्राई बिकॉज मुझे रील्स बनानी है, मुझे वो करना है, तो मैं ऐसे माउंटेन के ऊपर ऐसे खड़े होके ऐसा वैसा करके. आई वॉज रीडिंग टुडे मॉर्निंग न्यूज़पेपर. वन पर्सन he clothed with a red suit and all that with mask, and he jumped on a car and he was throwing money, 10 rupees, 20 rupees and all, and people were making video of that. Why he was throwing this money? He was caught after that by the police and all that. To make reels, to make this video, because I like having more likes, more views. Because of more views, I get more dopamine. Because of more chatting, because of more that, you get dopamine because of this only. Na? Spend more time on smartphone than sleep. It's also true. 6% check the social media. I'm talking about all WhatsApp and all this. Social media accounts. Every morning, the first thing they start with this morning is pick your mobile and start rubbing your eyes and then seeing that mobile and with all tuk. All nonsense. Nothing is important in that. 53 are connected to the internet every working hour. 53%, not 53. And the students, the statistics is there. The students, they are checking their mobile 150 times in a day. If I am wrong, calculate from tomorrow. How many times I am checking? Still I am in the class, I am seeing some people, they are doing all these things in the class also. So how many times? Is that important? Value, checking these mobiles. And I don't feel ashamed because I'm using this phone. It doesn't have any WhatsApp, social media, nothing. My concept is that mobile phone should be used only for calling or SMS. That was the purpose of that person who has devised this mobile. And you should take only calls. But people are fond of having all the such, instead of call, they are doing all these things. Why I'm using this mobile, and I'm still in the post, but nothing is being stopped. I'm working as an administrative dean here, deputy dean here, but my things are going smoothly. Everyone knows in the college that I don't use WhatsApp. They mail me. I have a PC in my department, PC in my house. I don't use laptop also. Because laptop, I'll say, we carry here and there when I go for a trip or when I go for a small get together friends. I will not carry my laptop. The thing is that why I'm using is, main reason is I never get distracted. When I am working something and I am doing something, I get focused in that. When I'm talking here, I'm very much connected with you. I don't check my mobile. Who has called me and why, what SMS has come and what media is doing and what all world is doing. No, I have a TV, but I don't watch no channels in that TV. I watch movies only in that, especially Hollywood movies, which I like. I take time for that because that movies gives me high. Happy hormones are released with happy movies, good movies. So I don't have to go for that. So just remembering here, the problem with this internet addiction is the eyesight. You're always rubbing your eyes. Why? There's no secretion. There's no secretion. The eyes become dry. Nowadays, if you see IT persons, dry eye is the biggest problem with this IT persons because they are 8 hours, 10 hours, 12 hours on the screen. They don't go off screen. Because of that, dry eye is very difficult to tolerate, painful. The symptoms have started with the school children also nowadays. Hours and hours they are watching this videos. Neck pain. This neck pain, this will be, once you will be a doctor, and some people will be orthopedician also here. One day will come, many orthopedician will be high that time. Today, you know the trend, which seat has gone boom for PG? That is for with the money. I am asking about the intellectual people who are scored more. What they have taken? Highest is medicine. First 50 students, toppers of NIT PG, they are taken medicine. Radiology is taken by the people who have money. Your time will be getting more because neck pain will be the biggest problem. Take it in writing from me. If you use mobiles, if you use the computers, you will be having a neck problem, neck rigidity, neck orthopedic conditions. Headache, low energy, infections, obesity, dry eyes, risk of life. It's always there. This is just I am putting some features of what you are using and what I don't say in my lectures anyway. I talk with the school children's, teenagers, society, everywhere. I never recommend them to stop your mobile. Don't use smartphone and all that. Difficult to stop this because if I have to put some message in this small mobiles, it's not a touch screen. You have to type and everything, and it feels little bit. It will take time and management will be difficult for this. But provided if you use these smartphones for limited time for your use, then it will be beneficial. WhatsApp also, I am saying same thing. WhatsApp, I have WhatsApp account, but I have never replied. Madam is here also. I have never replied to any group. I must be in the 15 groups in our college. All that admin groups say, student group. I never chatted in that group. I never wish any person happy birthday and all that. If I have to wish any person who is very important for me, I personally call him and say happy birthday or whatever, anniversary or whatever. That gives good, because if you are putting happy birthday messages, 100 of happy birthday messages, the person you will see, seeing that happy birthday messages, do you think that he really read that? And he remembers after 1 year also that this person has not wished for me? My friends, school friends, I was in a boarding school and from first standard till day, we are connected. Every year we are having a get-togethers. No one is disconnected from me because I am not wishing for their birthdays. They are not upset with me. They are having good relations with me. They call me. Even they call me for my birthday also. But still I am not calling them. So I don't feel ki everything you have to chat and you should wish everything. So we'll talk about everyone should know this. Cannabis is nothing but marijuana. The commercial products of marijuana is, yes, somebody said bhang, gaja. These are nothing but the dried leaves. Dried leaves are bhang and dried flowering tops are this gaja. This gaja is being used in cigarettes. They remove the tobacco from. I'm not telling you the method. You just remember if some person is doing this thing, you just watch it and say no for him because it's dangerous. And nowadays I'm seeing, unfortunately, in many medical colleges, many hostels, these are doing quite popular in the students. I don't know where we are going. So they remove the tobacco and they put this cannabis inside. This type the cigarette will be, and they will lighten it and they smoke. smoke. Various nowadays, if you see any, nowadays in the Pantabris also, behind that Pantabris there are hookah parlors, and some hotels they are using this hookah parlors. All this they are doing it the cannabis. Because you like that means something is there. Some chemical is there. And some addiction is there. Various types of pipes are there. It's nothing a bong. Nowadays it's used in many developed countries. India also started. Shot, taking a shot of drugs. Amphetamine, it's a drug, pharmaceutical drug. It is prescribed by doctor. But adverse is that it is used also for addiction. Vitamin. This drug is also used. All these drugs which you are talking about, they are releasing high dopamine, excitement, and the symptoms are same, what we have talked. By injection, these drugs are taken. Many drugs they are taken by oral route, injected route, snorting, liquid. It's all for rush. All this by taking this, they get in flashes, and it's pleasurable. That is why they are using it. Cocaine, it's very costly. It's called as rich man's drug because no one can afford it. Very, very costly. It is taken with this powder. Powder is snorted, and it gives effects in minutes. And we watch these things only in movies. Movies abhi dikhta hai. I was watching that day one movie. A South Indian movie, Vikram. Very famous, and I don't know how that person has become idol of youngsters. The villain, what is the name of that villain? Setupati, Vijay Setupati, yes? Huh? Setupati something. He used to take some drug and put inside this mouth, and so many movies they do this snorting and all that. And people get attracted to that. What is that? So, why I was talking about that movie, Vikram, part 1, 2 and 3 will be coming now. That Vikram gets high because of that drug. And after that drug, the movies they are showing that, itna high, you start beating everyone. किसको भी अभी वो कमल हासन को भी मार देता है, सबको मार देता है. इतना है, बाप रे. I feel because people like this, we get happy with that. अरे villain एकदम full form में है तो it's good. And we get excitement with that fights. This actually doesn't happen. The people, initially it is excitement and all that, but after some period, it gives low also, and people are trapped in that. Opioids, what someone is talking about, heroin. The important drug in pharmaceutical or pharmacy is morphine. Morphine is given for what? Painkiller. It's a till date. It's a good painkiller used in medicine. So they are also using for that also, and not only for painkiller, for also getting high. This is derived from poppy capsule. It is grown over Afghanistan, Pakistan, Turkestan, Tajikistan, and all that countries, undeveloped countries. Needle marks. If you find any friend with this needle marks and with the snorting and all that smoking and all that bongs and all that, you throw out from your room. Don't stay with him. PCB, nowadays this drugs has been very common. Nowadays the students, they are taking, not only in Mumbai and all that metros, in Pune and all that cities also this has started. And all that youngsters, and they are in trap of these drugs. The people they give, first what do the drug peddlers do? These drug peddlers, first they give small amount, free of cost. You take this, he gets high, he gets pleasure, excitement, euphoria, and he will ask for that. Second time also, minimum amount, have amount. Once he get addicted, then fix your amount and they will pay you. They will go for theft, go for crimes, and they will get money for that and then do this. MDMA, ecstasy, this is also called as love drug, used in parties, rave parties. हुआ था ना अभी Samir Wankhede and that raids, Shah Rukh Khan's son. This rave parties, this drug has been used. LSD also, same drug used in parties. Just have to put in the tongue and just see the blast. And with this symbols, छोटे छोटे ऐसे होते हैं, एक निकालना बस डालना है. Again disclaimer, remember that. Medicines, diazepam, it's a very good drug used by psychiatrists, medicine people and all that. It's a sleep inducing drug. But it is used in other way, that is for addiction. Diazepam, Ativan you get in medicals. Nowadays the prescription also, the government also banned. You can't get these drugs for without prescription also. But still, in black market, it's sold very highly. Nowadays in Pantabris and all that pan shops, they are selling these drugs. Recently there was a news in Malegaon. One drug is being sold, very popular, and people they are taking this, youngsters usually. It's called as kutta goli. नाम ही उसका कुत्ता गोली रखा है. कुत्ते जैसे हरकत करता है ना, इसलिए कुत्ता गोली उसका नाम नहीं. बस कुत्ता गोली बोलो, 2-4 रुपए में वो गोली मिल जाती है. You don't have to take all this cocaine and all that high drugs and high costly drugs. अल्कोहल लेने के लिए कम से कम एक बॉटल कितना लगता है अभी? More than 100? 200? I don't know. But this कुत्ता गोली 4-5 rupees 10. डाइजिबम का प्राइस मालूम है आपको कितना है? Maybe 2. It starts with 2 rupees. One diazepam tablet. But still the effect is the same. This is the commonest, biggest, largest selling drug. Government has legalized this. जो पहले हम लोग सुन रहे थे, they are all illegal drugs है. But government has opened the shop and they are selling these drugs, and government is also helpless with these addicts. And the good example of this is during your lockdown period, the first thing that was opened, I don't know what compelled them to start this liquor shops. I read newspaper 2 days back only, in the leading newspaper, that government is planning to open more liquor shops because these are very less and people are in the queues. They want to keep all this liquors on the shelf of stores, grocery stores, and everywhere you can get this, and start using this and make nuisance in the society. So alcohol is very common in the teenagers. They are busy. They start with the breezers and Budweisers and all that, and small beers and pint beers, low alcohol content beers, 7%, 4%, and start, and then 12, 14, and उसको पता भी नहीं चलता ये जो है ना डायरेक्टर स्पेशल, it's a whiskey, it's having a 42% alcohol. 4% से 42% कब गया उसको मालूम भी नहीं पड़ेगा. Because dopamine का और एक रोल है that I forgot. Dopamine gets high. अभी जो अचीव किया उसको मालूम था, उसको लेना था, उसने लिया बियर. 4 बार वही बियर लेगा, it doesn't get high. Start increasing dose. Start increasing. अब बियर से कुछ नहीं होता. They start with the gin, then the दूसरा क्या है अभी? क्या? I don't know why. People are shots and all that. Vodkas, yes. Vodkas and mocktails and cocktails and all that. So they get high, and one fine day, this is 750 ml bottle. The patients who are coming with us, they are taking a 750 ml or 1 liter, 48%, 42% alcohol in a day. We started with the beer, we started with the Budweiser, and nowadays I think one more drink has come into the market, and advertise is also very funny in this I see. It is there in the general stores also. Sting. One more is there. One more. Red Bull. Energize. And something is there. When you like that, when you like any product, something is there in that drug. That is why you feel that taking this drug.